Hi, my name is Dr. Mary Larijani. Welcome to Skin the Surface, a monthly segment where we will address important topics related to your skin. This show is intended to serve as an educational resource for members of our community. Our hope is that we encourage you to take a more active role in your skin health. We do not provide any personal medical advice, so if you feel like any of the issues that we discuss today apply to you, and we hope that many of them do, we recommend that you consult with your board-certified dermatologist for more information. So let's get started. Today I have Dr. Rina Allawh joining me.
Thank you for having me, Mary. Just to introduce ourselves, we are two dermatologists practicing at Montgomery Dermatology in the King of Prussia area. As close friends and dermatology colleagues, we have so many discussions about the skin, and so we thought, why not open up the dialogue with other members of our community? During each segment, we will skim, or shall we say, skin the surface of these topics. Before we begin, we want you all to get to know us a little bit more. So, Mary, can you tell us a little bit more about yourself and how you became a dermatologist?
Yeah, so I actually grew up in the mainline area. I'm from Villanova and I went to Radnor High School. Really early on, I thought that I was interested in a career in medicine. My mom is a nurse and my dad is a pharmacist, so I figured might as well be a doctor. So I went to the University of Michigan for undergrad because I heard they had a really great science program, and they definitely did. There I studied neuroscience, and I got a gender and health minor, which is essentially women's studies. And then from there, after 4 years in Ann Arbor, I figured it was time to come back to Philadelphia. And that's where I did my medical school and my residency training at Thomas Jefferson University. So why dermatology? Well, thinking about neuroscience and gender and health, I thought I'd probably be a neurologist or an OBGYN, and I just realized early on those fields weren't for me. So why the skin? Well, I'm a very visual learner, and you realize pretty early on in medical school, rashes are either very gross or very interesting to you. So we're definitely in that camp of rashes are cool. And so, you know, dermatology is a really exciting field. It's very dynamic, and there's so many aspects to the care. So it's a really great opportunity and a great field to be in, and we're so lucky to be here. So Rina, can you tell us a little bit about yourself and what got you into dermatology?
Sure. So I grew up primarily in upstate New York, very snowy Syracuse, a huge Syracuse basketball fan. And then in 2015, my family and I moved to Reading, Pennsylvania, and that's where my parents still live, and they love living there. And then I went to Penn State for college, and that's where I majored in biology. And I was between whether or not I would go to pharmacy school or medical school, but I really loved the idea of going to medical school after doing a number of volunteer opportunities. And then that's where I decided to go to George Washington University in Washington, D.C. And as a medical student, I had dabbled in different specialties, but what really interested me and what I found that I was so passionate about was actually dermatology. And I enjoyed a lot of the shadowing opportunities I had, and I had a wonderful opportunity to do a very fun summer internship at the NIH in Bethesda, and I loved that. And so from then on, I was very excited to come back to Pennsylvania and finish my dermatology residency program at Thomas Jefferson, which is where our journey began, Mary. And that's where I met Mary, actually. And after that, I just have been having so much fun with this career, and I wouldn't have it any other way. So now, Mary, we have a wonderful opportunity to see so many different types of patients, and a lot of people ask us, what do dermatologists actually do, and what do they treat? Well, as many of us know, the skin, of course, but what many people might not know is that we treat other types of conditions affecting the hair, nails, and the mouth.
Yeah, that's so true, Rina. I feel like we often get patients who come into the office for a skin condition, and over the course of that visit, they mention something going on in their hair or on their nails, and then they'll stop themselves and say, oh, it's not related to the skin. Like, I'll just bring this up with my other doctor. And they're always surprised to find when I say, well, no, we can actually help treat all of those things. So as a dermatologist, like you mentioned, we get training in how to treat conditions affecting the skin, the hair, the nails, and even oral diseases. And we learn how to medically manage these conditions, surgically manage them, as well as cosmetically manage them. So it's a really all-encompassing field that stratifies all aspects of medicine. Oftentimes we can treat the whole patient. We don't have to refer them to anyone else, which is really great. And the really great part about it too is that we see patients from all different walks of life. From pediatric years to geriatric years, you can really see a patient throughout the whole course of their lifetime, which is really unique.
Exactly, I couldn't agree more. That's one aspect of this career that I really love. We get to see so much diversity in who we treat, what we treat, and what we can actually do. So Mary, can you go into what it takes to be a dermatologist?
Yeah, so it's a lengthy road ahead if you choose a career in dermatology. So after college and 4 years of medical school, every doctor has to complete a residency, which is basically training in your specific field of medicine. So for a dermatologist, it takes 4 years to complete that. There's some dermatologists who will actually even extend this for a whole nother year and complete a fellowship. And that's just even more training in a really specialized field of dermatology. And those fellowships include pediatric dermatology, cosmetic dermatology, Mohs surgery, and dermatopathology. So if you think about from the start of your training, which would be college time, to the end of your training, which is when you finally become a dermatologist, it takes about 12, 13 years to get there, which can be a really long time.
Oh my gosh, that's crazy. I mean, that probably explains all of our gray hairs going through this training. And just to add, after the end of the training, all dermatologists are required to complete a dermatology residency training exam and a board examination. And so that is basically to prove that yeah, I am competent to successfully treat and practice as a dermatologist in my community. So now that we went through all of this training, it's just really shows how important it is that any patient see a board certified provider.
Yeah, that board certification is really an important designation, and it really kind of means something. It means that your physician has really gone through the trials and tribulations, the training they need to truly be an expert in their field.
I couldn't agree more.
Yep, so during the next several months, as we start these interactive sessions, we invite the community to join us. We're going to have different experts in the field, different physicians from the community, even community members who are going to talk with us about important and hot topics related to the skin. So let's dive into a little bit of what we're going to talk about in these segments. So the favorite ingredient for a dermatologist, sunscreen. So skin cancer is real and it's on the rise, and it's super important that we protect ourselves as early as possible from excess exposure, because studies have been shown and reports from the American Academy of Dermatology prove that using sunscreen can really decrease your risk of getting skin cancer. But this is a really hot topic recently, and that's because of more recent media reports that show that there's actually increased absorption of sunscreens in our bloodstream than we thought previously. The FDA had a previous designation of what was safe, and it's been shown that these absorption levels kind of surpass it. So what that means, we don't quite know yet, but there's been a lot of hysteria in the media and a lot of concern, understandably, that this may increase people's risk of getting cancers down the line or even cause birth defects. So this is a topic we're going to dive really deep into because we feel so strongly about it. We're going to talk about all different kinds of sunscreens, which ones you should be using, and how early you have to apply them for them to be effective. We're also going to talk about alternatives to sunscreen for people who are a little bit weary of it or who are concerned about the coral reef, which is a real issue as well. And then we're going to talk about these studies, and we'll talk about what they're really showing and what they really mean, and is this hype and is this scare real? And so that will be one of our topics that we go through.
Very interesting. And for our new parents out there, soon to be parents, we'll review some helpful skincare tips for your newborn. I know this comes up a lot with our patients. Finding skincare products with baby-friendly ingredients can be really stressful for any new parent. And so we are often asked, are organic products safer? Are they better? What moisturizers, soaps, detergents should I use, especially for a newborn? So we'll go into all of that and answer all of those questions as well, and discuss some of the common skin rashes that we see in newborns and infants, including cradle cap and diaper dermatitis or diaper rashes. So we'll go into all of that. We'll also talk about some of the common conditions that occur at different stages of our life, and how our skin changes over time. And so we'll talk about common rashes and skin conditions in adolescents and young adults, specifically acne, dandruff, and sexually transmitted diseases, because this comes up a lot. And we'll really stress the importance of sun protection in this age group. And we see a lot of young adults, Mary, who come in and they're not necessarily wearing sunscreen, or they occasionally use the tanning bed here and there before prom. And so we'll talk to them about how important it is to really protect their skin from the sun at this point, because one blistering sunburn during childhood or adolescence can nearly double your risk of having a skin cancer later in life. So that's a pretty striking statistic. So we'll go over that. One other thing that I find very interesting, and we'll talk about and have a segment on, is common conditions that occur in the middle adulthood, such as hair loss, hormonal acne, rosacea. So we'll go over all of that, as well as specific skin concerns unique to the elderly population. And so over time, we develop new growths, and we're more likely to have certain types of rashes, and our texture of our skin changes over time. So we'll go over that. Now it's how it's unique to that patient population.
Yeah, and it's not just age groups we're going to discuss. We'll also talk about skin conditions that are unique to different populations of people. So, for instance, we'll have a women's health segment where we talk about female-related issues that can occur on the skin, such as before or after pregnancy. There's so many rashes that happen. People get worried about all their moles changing, like what's real and what you should actually be concerned about. We'll talk about hormonal acne and the effect of other endocrine conditions, such as polycystic ovaries, that can affect excess acne, or even that dreaded bacne that everybody hates. And then we'll even talk about melasma, which is a darkening of the skin that has a very strong hormonal impact as well. And then another topic that I know that you feel really strongly about, Rina, is we'll discuss in our Skin of Color segment, is this really growing and really dangerous trend that people are performing. It's been called skin bleaching or skin lightening, and it's gained a lot of popularity in this country, but also internationally.
I couldn't agree more, Mary. And like you said, being Middle Eastern, I have a lot of family members who ask me all the time about skin lightening products. And so, in certain ingredients that are in skincare, skin lightening or skin bleaching products. And so this has become a huge issue in social media, and been very popular, especially in certain cultures where having a fair complexion is thought to be associated with beauty, higher status, and wealth. And speaking of social media, we'll have a specific segment on media or medicine in the news and social media, and who is really fact-checking this information, and is the information that you're reading out there, is it from a trusted source? So we'll go into all of that, because I know personally, and I know you probably agree as well, is that there's so much information out there in terms of skincare hacks and beauty products and skincare products out there, that it's really hard to sift through all that information. It can be overwhelming, not just for the consumers, but for us as well. So we'll discuss that as well.
Yeah, it's so true. I feel like every week I get some text or email or direct message from a friend who's like, what is this new product, and does it really work? Should I be using a skin roller? Like, what about this laser device? I mean, there's so much information out there on the internet now, but a lot of it's being provided by people who aren't adequately trained, who aren't really doctors. So it's important to know where you're getting information. That's going to be such a good topic to talk about. I often get a lot of questions from family and friends like, oh, I saw this cream online for anti-aging. Is this a good one to use? Well, we'll go over what's actually important to use, where the research shows us this is actually showing a benefit. So one thing I love to share is the 3 products that every single person should be using on their skin. We won't reveal them yet. You'll have to tune in. But that's a really fun thing to talk about. Another inquiry we get a lot is from people who are new brides or in a bridal party, and they have an upcoming event that they want to look their best for. Or they're thinking about starting some cosmetic procedures and they just don't know when's a good time. So we'll go through a timeline for all of that. When's a good time to do it, if you're considering it, and what to consider.
And just to mention one other topic that's really hot right now is just, does what we eat impact our skin? And so we get a lot of questions about, certain fad diets, and will they work? Will they help my acne? Will that help my eczema or my dry skin? And so we get a lot of questions about that. So we'll also have a segment on that as well.
Yeah, that's really good. And so, you know, like we get all these questions from family and friends, and it can be overwhelming at times, but this is also our passion. This is what we love to do. We love to help people make their skin healthier. That's why we decided to go into medicine. I think from an early age, at least for me, and I'm sure you can agree, Rina, you realized that you wanted to be a caretaker and take care of other people, and that's really what got you into this field of medicine. But there's so many people out there who have that same sentiment, but really don't know where to start, or how do you know what career in medicine is right for you? Is a physician the only way to go? That's kind of what I thought when I grew up, but these days there's so many other routes for people to get into the medical field. So we'll even have a segment on that for people who are interested in a career in healthcare, what the options are, either as a physician, a nurse practitioner, a physician's assistant, an occupational therapist. There's so many ways that you can get involved in the healthcare system. So we're gonna go through all of that. So stay tuned. We've got some exciting topics ahead.
I'm excited.
All right, well, that's all we have for today. Thanks for joining in today's discussion about your skin. We hope you learned something new. If you like what you heard today, tune in to our Skin the Surface podcast available on iTunes and Spotify, or visit us online at skinthesurfacepod.com. See you next time.